Hi, good evening, friends. I am Dr. Ashok Loda. I am specialist pediatrician and specialist neonatologist at Belhol Specialty Hospital, Dubai. And I hope I am visible and I am audible. Big hi to you, and I am happy to see people have joined, and many people are still joining. I hope you all are healthy, safe, fit, and fine. Friends, let me thank first of all First Cry and Mustela, their digital platform, for giving me an opportunity to have live interaction with you all. Friends, we are passing through an unprecedented time. We all know it's been almost 6 to 7 months ever since this corona was declared as a pandemic. Almost since March there had been several lockdowns, etc. And we all are scared of the corona and the COVID-19. Just to give some inputs, is corona and COVID-19 same? Well, till some people are joining, I can tell you briefly, COVID-19 is an abbreviation. What it stands for is CO is corona, VI is virus, and D is disease, and 19 is year 2019, why it was when it was discovered in Wuhan province of China. So corona, CO, virus, which causes disease in 2000 because of the virus which was detected in 19, that is called COVID-19 once it enters the body and causes symptoms, because corona is a big family of virus. What we are witnessing, what we are afraid of, what we are going to talk today is specifically COVID-19. Now friends, we all are eagerly and desperately waiting for vaccines. Trials are going on. In fact, some human trials have started. Some people have volunteered in UAE. We are very lucky to have government who is so proactive. By the way, UAE is among the top few countries in the world who are so successful in controlling. Though today's figure is almost 1,000. Is it a thing to worry too much? Yes, it's a concern. But at the same time, we are in a place where government is so supportive, and we all have responsibility. We keep hearing in FM news, etc. And the whole purpose of today's live session is to make you understand that until the vaccine arrives, how we can prevent this virus from having community spread. There are only two ways. One is maintain hygiene, and to maintain hygiene, we need to have, by hygiene I mean hand hygiene and using some things which prevent infection from catching infection and spreading the infection. Other method is using mask, and third is social distancing. Now using mask and social distance is a very important integral part in prevention, but if time permits, I'll be talking about that. My focus in initial 5-10 minutes, then I'll be taking your questions also, is about the hand hygiene, since it is related to hand, and our hands, of course, like it has a skin, so it has a lot to do with the hydration of the skin as well. Now, what is correct hand hygiene? I'm sure last 6 months you must have seen a lot of videos recommended by WHO and CDC. Just to quickly summarize, the hand hygiene means that whenever you are going out or you are touching shaking hand with unknown persons or some surface, you make sure you clean your hands under a tap water. Two things: the temperature of the water should not be very hot or very cold. It should be lukewarm, and there's a reason behind it. And it should be running water. It should not be stagnant water. And then you can use a soap bar without any antibiotic component, plain soap bar or liquid soap, both are same. Apply on the palm, and then use 5 steps. Rub the sole, the thumb, and interlace your fingers, the back of the palm. And lastly, I want to remind you, most of the bacteria, they are present under the tip of our nails, exactly here. So don't forget, don't be in a hurry. Please make sure you rub these fingernails. That's where bacteria are lodging. And what does washing do? Hand wash does, it just washes off. It washes off your dirt, maybe some greasy palm, and in the flow of the water, it cleans all the microbes and the germs. So water doesn't kill, but it cleans. So, and do this washing for 20 seconds. They always saying happy birthday for 20 seconds. You know all those things. And once you have cleaned, make sure that you air dry it or use a paper towel. Now, or else if you don't have those, you can use any towel. But the important thing is you make sure you don't do vigorous drying of your hands, because we have a naturally occurring lipid layer on our hands on whole of the skin. If you now be mindful in if you wash your hands 1 or 2 times, it's fine, but you never know, some people have to wash it maybe 10-12 times in a day. So at that time, just imagine the amplitude of friction. If you do it vigorously, it rubs off a lipid layer. That's where dryness comes in, seeps in. That's where cracking can come in. So make sure 2 important things: 20 seconds, temperature should not be very hot or very cold. Rub the bottom portion of the nails, so that hand washing is adequately done. And then if your skin is sensitive or having eczematous skin, then frequent hand washing can aggravate that condition. So that time there lies the importance of using some moisturizer. Now when you want to use a moisturizer cream on your hands, make sure hands are not totally dry. Let there be some moistness on the hands, and then apply the moisturizer cream. Now what are the big advantage of hand washing is it can be done from all age group, from as small as a newborn baby to older age group. Number 2, it is one of the easiest and one of the best way to get rid of the germs. Number 2, in places where sometimes you don't have facility for running tap water or to wash, in that case there comes the role of hand sanitizer. Now the WHO and CDC recommends that whenever you buy a hand sanitizer, make sure you check its ingredients. What they recommend is it should have ethanol or ethyl alcohol, which should be minimum 60%. It can be 70% also. So check the percentage, check the ingredients. Either it should be ethanol or isopropanol. Both are fine. Now third thing to know is make sure you read on that bottle that it should mention if it is denatured ethanol. All the more better. What does that mean? That the manufacturer has deliberately put an ingredient so that it tastes bitter. And why this is necessary? Because children below 5 years of age may by mistake or accidentally can ingest that alcohol. It contains 60 to 70% alcohol, and it is that same alcohol which is there in a drinking alcohol. Their percentage is something from 5 to 40%, and this sanitizer is having 60 to 70%. So just imagine, it's more than the highest dose of a drinking alcohol. So child by mistake, if he ingests, he can go into alcohol poisoning manifestation. In fact, there was a data in US which says that there were, ever since these sanitizers were used widely, there was 36% rise in the calls to the poison center because children had consumed that sanitizer by mistake. So sanitizer also works well. The alcohol kills the microbiomes and the germs. What is the difference between microbes and germs? Microbes are the skin flora or the normal bacteria on our hands, and germs are other pathological organisms which can cause disease. So this is the disadvantage of frequently using sanitizer. It kills the germs as well as the healthy bacteria also. So it is useful in situation where you don't have facility of water, and it is more useful if you apply it correctly. Once you apply sanitizer on your hands, you let it remain there at least for 20 to 30 seconds. You rub your palm for 20 to 30 seconds and give it a time to show its effect. So for 2 to 3 minutes, let it evaporate or dry on its own. you don't rub it off immediately, otherwise the desired action will not be there. And then the important thing is that make sure you keep this sanitizer out of reach of the children. One of the other risk is you avoid using this sanitizer in children who are less than 1 year of age, because their skin is sensitive. Even for older children, if you use sanitizer for a long time, for a long duration, you can develop dry skin. And those of us who are born with sensitive skin, who have a propensity to have allergy or eczema in our skin, for them this sanitizer, be very careful in using, it can aggravate. So what is the remedy? We should keep some moisturizer in our hands so that we can apply it. So these are the two things I wanted to briefly tell you before we go into some question and answer sessions. And this live session is about our hygiene of the skin and dehydration. So I think I have few questions which I have answered partly. One question is from a mother who wants to know that their kid is less than 2 years of age, and how do we protect from COVID? And then she pertains to that same thing, that she's afraid of using hand sanitizer. Yes, it's a very relevant and pertinent question. Kids less than 2 years, their skin is of course sensitive. So to protect from catching COVID infection, first of all, unless it is really necessary, avoid taking such small kids out, especially in an area which is crowded like malls or parks where too many people are there. First of all, sanitizers we should avoid. Number two, if at all you take them out, even WHO recommends that they should not, below 2 years, they should not wear mask also, because of obvious reason. They can get suffocated or choking, and more than that, they don't tolerate also. The compliance is not good. So avoid taking them out to crowded area. If at all you have to go, make sure that you do regular hand washing in them. And then if sanitizer is to be required, make sure you give in small quantity. The other option is there are some baby friendly cleansing wipes. In fact, Mustela also has those wipes which can safely be used right from 1 day of life. So they will act as a sanitizer, but it is more useful and less harmful. So that is one option you can use. Now there's another question which mother wants to know, that during this COVID time, what is the degree of fever they should be worried about, and what are other danger signs they should take care of. COVID time or no COVID time, the fever is always defined as more than 38 degree centigrade or 100.4 Fahrenheit. Anything below that you should not be worried at all. If you have one spike of fever more than 38, of course you have to give whatever medicine, fever medicine. The safest is paracetamol, called Adol or Panadol, which most of us do keep at home. You can give that. It will bring down the temperature within 30 to 40 minutes if you give by mouth, or if you push from down what is called suppository, then it will bring the temperature down faster. Now, when you should worry, when you should go to a doctor, or when you should take teleconsultation is if the fever doesn't come down with normal doses of paracetamol, or fever is very high, keep on coming continuously. Along with that, few other danger signs, that child's sleep is disturbed, child's eating is disturbed, child is breathing fast. So these are some subtle soft signs when you should be worried more, and it's better and safer to take your child to a doctor. Now, one more question, of course, it is in general related to the vitamins and the formula feed. One mother is asking that my kid is on formula feed. Do I still have to give him some multivitamins? Well, most of these international good brands formula feeds are already enriched with vitamins and trace elements and minerals. So there's no need to give extra vitamins. If the baby is on breastfeed exclusively, then of course you have to give vitamin D, 400 international units, until 1 year of age, till he starts taking weaning foods which are rich in vitamin D. Another question which one of the mothers says, that her kid is not drinking milk or any fruit juices, he's drinking only water. So she's struggling and having hard time to give some milk or some fruits. Well, I presume that child's age would be above 6 months, since she has already started weaning food. Only thing is the baby is not taking milk. Well, by milk we mean dairy product. So you have other form of dairy products in form of yogurt. If child takes yogurt, it's fine, it comes to one and same thing. And then if child is taking adequate amount of water, that's fine, he's already taking. Now it's not necessary that child should drink fruit juices. In fact, below 2 years of age, we don't recommend to give fruit juices to the child. Why? It contains more of a water. Instead, you can make fruit pulp. You have fruits at home, just make it in a pulp form and then give it. So it will the calorie and the quantity and quality both will go inside, and water will be less as compared to the fruit juices. So don't worry too much if child is not drinking milk. Other form of dairy products you can give. So you should not be worried. I got one more question which says that I am a nurse. Do I need to sanitize hands with sanitizer before touching small babies? Yeah, and I do take care of some newborn babies also. Yes, this is a very valid question. Even in my OPD, we have newborn babies for follow-up who come. They are maybe 4 or 5 days old, and as per DHA protocol, we are supposed to hand wash and hand sanitize also. The friends, I just want to tell for my colleagues, doctor colleagues and friends, that if you are handling a newborn baby and you're using sanitizer, make sure your sanitizer it gets evaporated, shows the effect, and there's no smell or irritation. So don't touch the baby before 3 to 4 minutes. So leave that sanitizer on your hand for 3 to 4 minutes, because if you put sanitizer, rub your palms for 20 seconds and immediately you put your hand, it really irritates babies. You're holding the baby's head and face, you don't realize it. You yourself can sometimes smell it. It is really irritating to the nose and eyes. For newborn, their eyes and nose are very sensitive. So immediately after using hand sanitizer, don't hold the baby. So, just let it evaporate, the sanitizer, and then hold the baby. Or else the other option, best option, is to wash your hands. And third is, I told you, these cleansing wipes, which has natural product. They are not so irritating to newborn skin. And then one more question is that how to differentiate seasonal flu from COVID symptoms. Yeah, well, it's not easy. It's not easy because the COVID symptoms are also due to a virus, coronavirus, I told you. Initially, there's no way you can really differentiate. Only once the disease progresses, I'm talking of clinically, only once the disease progresses, the flu symptoms, usually they subside, whether it is fever, running nose, cough, throat pain, usually they subside by 3 to 4 days of life, of the illness, usually. And the COVID symptoms, the coronavirus symptoms have such a variable presentation that initially it's no way you can differentiate. But you have to have high index of suspicion, especially in the present scenario when you have so much of community spread. What is that index of suspicion? If you have some COVID patient in your own index case in your house, or your child has been exposed to outside where there was some COVID patient, That is the time, even if it is mild symptom, looks like flu, it's better to get COVID testing done. In case you are not exposed to COVID patient and you have mild running nose, fever, cough, cold, then if child, there are more danger signs, child has fast breathing or child has vomiting, diarrhea, and child looks more sick, then the only way to differentiate normal flu from COVID is to go for RT-PCR test, which is there. You have to go to government hospital or private hospital to get it done. There's one more question. We say that any cream recommended for babies having rashes, and is rashes a sign of COVID? Usually no, rashes are not a sign of COVID. COVID signs, I told you, I can repeat also, common signs are just like flu: running nose, fever, cough, cold, nose block, throat pain. So basically it is an airborne infection, spreads from person to person. So our airways are involved first, from nose, back of the throat, and then it can go deep into the lower airways and cause pneumonia. But some rare symptoms are there. Some people, some literature have also shown that they have loss of smell. So if you see sudden or acute loss of smell, this would be appreciated, of course, in an older child and of course in an adult. Sudden onset loss of smell is an indirect evidence that this could be flu. Other rare symptoms of, not flu, COVID. Other symptoms of COVID would be, they can present as a stomach or intestinal upset in form of diarrhea, vomiting, pain, abdomen, and sometimes it can very rarely manifest directly as a brain symptoms in form of meningitis, like headache, throbbing headache, or continuous vomitings. Rash, only rash per se, less likely to be COVID. Yes, but if a child has COVID-like symptoms and then develops rash, oh, that's a danger sign. You should rush today, because rash is a very general term. There are many types of rashes. Some are benign, harmless, nothing to be done, but some are really life-threatening and dangerous, which for a parent at home it's difficult to decipher or interpret. It's better to take the child to hospital. One more question is there, that are children under 1 year of age high risk for NICU if infected with COVID? Are under 1 year old child high risk for NICU? I couldn't understand the question properly. I suppose what the mother wants to ask is, 1 year old child, if he goes to NICU to visit the small baby, is there chances of COVID infection? I suppose that's the question. Yes, NICU is a very tertiary care special area where premature babies are kept. So COVID or no COVID, any baby, any adult, if he has flu-like illness or any disease, he should avoid going to NICU. It's really not recommended, because we have a lot of premature babies who can catch infection. They can see the baby from outside only. Now, if the question meant that he can catch infection in the NICU, no, that's not likely, because they are kept in a very proper and hygienic and sterile zone. Yeah, sorry, the question, I got some correction in the previous question. It says that if a newborn baby, yeah, it's not 1 year, but small baby who has COVID infection, do they have high chances of being admitted to NICU? No, NICU is for babies who are delivered, born, and have some illness. If they are infected, then they are kept in a separate isolation ward or isolation zone. And obviously, if you have a baby, newborn baby or 1 month old baby who has COVID infection, he cannot be kept with the other babies in the NICU. There will be a separate, like For adult also, COVID patients are having separate COVID ward or COVID rooms. So those babies will go to a separate room. Can babies recover from COVID infection? First of all, the COVID infection incidence is much less in small children as compared to adult, but they are not immune. They do get infected. Chances are very less. Now, the transmission of COVID virus from pregnant mother to newborn baby is very, very less. Some of them do get it, but they recover very fast. So is the case with smaller children. Most of them, even if they catch COVID infection, COVID virus, most of the time they recover. Most of the time are asymptomatic, but if they have some certain symptoms, they recover very fast. Certain percentage, maybe 2 to 5% of them, they do get into rapidly progressing disease, what is called multi-inflammatory syndrome, which is of course dangerous. So, but by and large, kids are protective. They are not getting that much infection. That is a good news. But we don't have to put off our guard. Make sure you maintain the proper precautions like hand wash and social distancing and wearing mask. Yes, and other thing is whether it is adults or kids, in case they have some associated comorbidities like diabetes. Even kids can have diabetes, or they are born with certain inborn metabolic disorders, or their immunity is low since birth, or they have chronic liver or kidney disease. Those comorbidities make these patients more prone to catch infection, and they can go into complications. This holds true for adults also. Yeah, related to that, there's one more question. One mother is asking that are there any supplements to build immunity for kids? Yeah, this is a commonly asked question. Well, no, there are no supplements. This is a very common question and common myth and misconception that you give X medicine, your immunity will go up. First of all, we need to understand that if your immunity is bad, low, there are only selected few conditions. Either you're born with a low immunity, there are what is called primary immune deficiency disorders. Those kids is separate set of groups. They are born in that, they manifest quite early. So in those children, there's no role of medicines. You have to handle their symptoms. Or if you have acquired immunodeficiency syndrome, one is born, that is congenital, or you have AIDS, what is called AIDS, in children or in adults also. There you have immune deficiency. Again, there's no medicine to boost up the immunity. Or you are taking chemotherapy or anti-malignancy medicine. There your immunity is depressed. So these are the set of children where immunity is low, and you have to this is another high risk category where chances of COVID infection are more. So there are no specific medicines which can boost your immunity. If your immunity is normal, you are healthy, you don't fit into the criteria of recurrent infections where we suspect immune deficiency, then there's no need of any vitamins or trace elements or any other immune boosters. By and large, it doesn't help. Certain things like exercise or some yoga, there's no scientific evidence, but say that it can help you in maintaining good health. Whether it works through increasing your immunity, it's yet to be ascertained, but there's no immunoboosters. Now, another question is, one second. Okay, one more question is there that my son is due for meningococcal vaccine. I'm afraid to take during this time. Will there be a side effect if I delay the vaccine? Yeah, and how long can vaccination be delayed? Yes, these are two questions. Yes, this is a very relevant question. In fact, DHA and CDC and WHO has took a very firm and strong foot stand that please do not delay vaccine because of corona or COVID virus. Do not delay. Give it on time. We have seen even when in March, April, newborn babies, the parents were bringing their small babies to hospital to get them vaccinated. Meningococcal is given at 9 months or even 2 years of age, so there's no reason for you to get afraid because of coronavirus. You can give vaccines and there's no reason to get it delayed. And due to any reason other than coronavirus, if it gets delayed, there's no harm, but don't postpone it for a longer time. 4 weeks, 6 weeks, 8 weeks, that's fine, but get it done. Because of corona, there is no contraindication. Follow that your regular immunization schedule. Another question is that if I get infected with COVID, should I continue breastfeeding? Yes, this is a valid question. Breastfeeding is the best feeding. It gives multiple advantages. So you have to take due precautions. How you protect by wearing mask, hand wash, hand hygiene, and of course you can't maintain social distance with a small baby. So mask is the answer. Clean hands is the answer. If you can use sanitizer, then make sure after 3 to 4 minutes you hold the baby. You can use wipes, or if so breastfeeding is not contraindicated. It doesn't transfer through, the virus doesn't transfer through breast milk. It will only be transferred through the droplet infection. So you check that droplet infection wearing mask, and the regular cloth mask. If at all you want to be more assured and secured, if possible you can use that N95 mask, which is much better, which we healthcare professionals are using. Due to any reason you cannot do that, you feel suffocated, choking, the other way option is to you express your breast milk and give to baby. One more question is that my child is having surgery for spina bifida occulta. What can I give to my 1-year-old child to boost immunity? Well, this I had already answered. Surgery is one part. I'm sorry to hear that. So you follow the doctor's precautions and medication which he has written post surgery. Again, both has the spina bifida is a condition. For other viewers, I can tell you that the lower part of the spine, there's a gap. Babies are born with that. Now this illness, this disorder has no relation with immunity, no relation. So you treat your child as any other normal child. Give regular normal diet, normal food, and take care of the post-surgical care, and make sure he takes adequate carbohydrate, proteins, vitamin, trace elements, and maintain his hygiene. Yes, hygiene is important, and vaccination. And you should make sure when you are taking care of the diaper, the bowel and bladder area, you should maintain it neat and clean so that infection doesn't transmit. Skin hygiene, yes, skin hygiene is important. There's one more question. My 2-year-old have sensitive skin and is very allergic. Which lotion you can recommend? Normally we have 3 types of skin: normal skin, sensitive skin, and very sensitive skin, or what is called eczema. Now if we have a normal skin, still it's better if we use a moisturizer. Now since this question has come up, I just want to tell you the difference between the hydration and moisturizer. In skin, our normal skin by nature, the cells in our skin layer are having water. Our body has water. So our skin cells are hydrated. So they should be hydrated. And at the same time, the dermis layer, the epidermis, and below that there's the dermis. Dermis layer produces sebaceous, it has sebaceous gland which produces oil. Now this oil forms a thin layer on our top of our skin. So this lipid layer is so important. So ideally a normal skin should, to prevent drying, it should have both well hydrated and it should have a lipid layer also. The lipid layer prevents evaporation of water from our skin cells and it gives a protective layer also. So if you have good hydration and good oily skin layer, then your skin will feel soft, supple, spongy, and it will have the glow. Now due to you, if you're born with a sensitive skin, then you have to maintain hydration, you have to drink good water, plus due to some reason your lipid layer is bit less, that's the reason it's becoming dry. So you have to apply some moisturizer. Now there are various moisturizers are available in the market which contain some chemical ingredients in form of glycerin, paraffin, urea, hyaluronic acid. There are many available, the moisturizers are available, but preferably we as a doctor would advise to go for a product which has natural ingredients, and the natural best moisturizer would be avocado. So once few of the Mustela products do have those qualities, so they are recommended, they are safe for your dry and sensitive skin. Now if you have extra sensitivity to the extent that there is an eczema, then you can go for another product which is specific for eczema or highly sensitive skin. So you use this moisturizer which has a natural ingredient that you have to use continuously so that skin is not dry. If skin is dry, there will be cracks. Once there is crack, the integrity of the layer of the skin is broken. It will give the inroads to the bacteria, they will colonize, they will get infected, you will have itching. Then once you start itching, there's a vicious cycle, so the eczema gets worsened. So to prevent it from going to that stage, make sure you use regular moisturizers. Okay, and I think these are the questions. Yeah, if you have few more questions, please do let me know. Yeah. Yeah, for dry skin and moisturizer use, be careful when you have a baby who is less than 1 year of age. I told you earlier also, use of sanitizer we avoid giving in children below 2 years of age because they contain some chemical ingredients which can aggravate the sensitivity of the skin and things can get from bad to worst. So I think it's a 40-minute session. We are almost at the end of it. If you have some more questions, you can please ask me, or you can leave in the chat box. I'll be more than happy to answer it. So friends, I just want to say 2 more things about prevention. As I told you, vaccine is yet to come. Trials are going on. We all are waiting. Until then, what do we have? We have only 2 things in our hand. Prevention by hand hygiene, which I already discussed. Hand wash, use sanitizer judiciously. Less than 2 years, please use wipes, or else hand wash. Hand wash is the best thing to do in children below 2 years. This is the important take-home message. Number 3, there are situations where you cannot use mask. There are only 3 conditions: children below 2 years of age, or those who are unconscious, don't put mask on them. Those who are physically disabled, who are deaf and dumb, they cannot say that the mask is choking. In these specially disabled persons, avoid using mask. And then what to do? The best way is to maintain social distance. we are using masks so that if I have a corona infection, if I cough and I don't have mask, I can spread by droplet infection to others. So the purpose of mask is to prevent my infection, if I'm infected, from spreading. The usual cloth mask cannot prevent entry of virus coming in, because those viruses are so tiny and they are in the air. So it prevents spread of infection from me to the community. You have to wear. And number two, if you have a mask, you become mindful. It keeps reminding you that this is not regular normal time, this is COVID time. Most important is maintain social distance. At least 6 feet, 2 meters, two arm length away. Because if you are maintaining social distance due to exceptional circumstances, even if you are not using mask, then chances of catching infection and giving infection to others are very less. Social distance is more important, and avoid going to the crowded area if possible. And of course, then you have to use the hand wash technique. So together we all will overcome this. Lastly, I would surely say that please don't get panic. Make hand washing a regular routine. Follow proper CDC guidelines how to do hand wash. And yeah, excessive, last thing, because we don't know, another 2-3 months this infection will go, it will stay. So the hand washing is part of our life. It is much easier and better to do regular hand washing properly rather than applying sanitizers more frequently. That is a chemical. It can cause irritant dermatitis, chemical irritant dermatitis. And if there's no option, you have to use sanitizers, then it's always best to use a moisturizer cream, even if your skin is normal. So I hope some of these tips would be useful. Yeah, few more questions have come. I can take that. My son was born at 27 weeks. He is now 3 years, and at 3 years of age, 13 kg. Is it normal? Yeah. Well, 27 weaker baby is really tiny. At that time, I presume his weight must have been somewhere around 700 grams or 700 to 800 grams. So going by that small age, 13 kilo is good weight. Even full-time baby who is 3 kilo, for them also 13 to 14 kilo at 3 years is not bad. It's fine. We put in the growth percentile chart. They are available on the website, on WHO site. You can put that. It is maybe around the 50th or the 60th percentile. Fine enough, no problem, it's fine. It's 37-degree temperature normal for toddlers. Yeah, temperature is 38 degree centigrade or 100.4 Fahrenheit. That's temperature. Below that, it's not temperature. And number two, please don't be scared of this fever. Fever is a body's protective mechanism. It's a warning sign. Never be afraid of fever. Fever gives you a signal. How we put horn on it's kind of a horn on the car, which what we do. So I told you danger signs, right? Very high fever, very high fast breathing, less intake of food, less sleep. That is the time you should worry. Only fever, please don't bother. Give paracetamol. It's one of the safest medicine. What is the precaution while flying babies and kids? Yeah, you mean the air journey flight. Yes, nowadays we have very technologically very sound aircrafts. Gone are the days when there used to be pressure difference and our eardrums used to pop out. There's no special precautions. These babies should be handled as any other babies. Make sure you cuddle. Some of the airlines for small babies, they do provide some bassinet where babies can sleep. So there's no extra medicine, no medicine to make the baby sleep. No, please don't do that. It's a regular thing. There's no special precautions unless baby has some illness. If he's a normal baby, even if it is I think airlines has rules. Some of the airlines do not allow babies who are less than 3 weeks old, small baby, newborn who are born. but if airline allows, that's the routine care. Okay, I think it's almost going to be 50 minutes since we started. I think we can wind up the session, and I will be really more than happy if you have some more queries related to skin hygiene or COVID time, corona time. My take home message and hope for all of us, let's pray that we will overcome this crisis time, and which we have to adjust to this new norm. Thank you very much. I again thank Mustela and First Cry for giving me an opportunity to interact with you. You can leave some questions in the chat box later on, and they will be passed on to me, and I can surely get in touch with you. Thank you. Stay safe. Be healthy. Good night.